I'm a trainer specializing in behavior, and this case was super weird, and it's actually still ongoing, but it was a situation where medical issues were impacting my ability to train, and I don't know how someone else didn't figure it out first, but here we are. So I got to the house. I was not their first trainer. That's important to note because other trainers did not say anything about this. And when I saw this behavior I'm about to show you in a clip, I said, does she do this all the time? And they said, yes. So I said, gosh, that's weird. That's not what dogs should be doing. And we need to go to the vet. I had been hired to help with issues at the vet. So part of the problem probably is that the vet couldn't do a really thorough exam on this dog because of her issues. But I was also hired for other fear, anxiety, things like that. And the dog was already taking medication for anxiety when I met her. So fast forward, I get to go to the vet visit because it's scheduled during the same time as my appointment. And the vet is doing their best to do an exam on the dog and figure out what's going on. The differential that the vet offered included their top theory, which was that this was a side effect of the behavior medication, which I have never seen this as a side effect of the behavior medication before, but I'm not a vet, so I sort of made a mental note and then said, okay, what else? And their next thought was that this could be just a facial tic. Also not something I've seen before, but we made a mental note. And third option, they said, was possibly focal seizures, and in which case they would want to treat with a med called phenobarbital. I have actually had a couple of dogs who had focal seizures, and what I was seeing did not remind me of what I saw with my two dogs, but that's a really small sample size, right? I'm just a trainer. Vet has seen hundreds, thousands of dogs, so what do I know about it? My 2 cents looking at it was, if I did this, it'd probably be because I was trying to clear my ears. But I also thought, could it be something in the mouth? Need some, like a dental cleaning? Could it be something in the nasal passages? Could it be something in the throat? I kind of thought we maybe need to look with imaging to figure out what's going on. But again, I'm just a trainer. I need to stay in my lane. What do I know? So off we go. We wean off of the behavior meds, and the behavior doesn't get better. It actually gets worse. So then the vet says, okay, let's wean back on and then move forward, or let's think about starting phenobarbital. What do you want to do? Client says to me, I don't know what to do. What should you do? What should we do? And of course, I don't want to step on any veterinarian toes, but I say, well, if it were my dog, I would probably get a second opinion, just because starting phenobarbital is a pretty big deal, and not starting it if these are seizures is also a big deal. They could not go to veterinary behavior because their insurance would not cover that, but they could go to neurology. So off they went. And check out these screenshots I'm going to share of what they discovered at neuro. So one, always push for a second opinion if you're not sure what to do. There are vet specialists out there for so many things, and don't be afraid to ask for referral to specialty care, especially if you have pet insurance that covers it. I will update you later once we get a little further past this to see if the dog is able to now pursue training with medical issues cleared.